My name is Skåra and I live in Norway. I was diagnosed with PH in 2005. At that point, there was no patient association in Norway, so I started one a couple of years later. A couple of years after that, I joined the European PH community, PHA Europe, and I've been working as a staff member there. And during this last period, I was the interim president for PHA Europe. So today I would like to talk about the patient charter, which I think will be important for the global PH community. But let me just talk very briefly about PH first. PH is also referred to as the other high blood pressure. You measure the blood pressure on your arm, which is the regular pressure, but then you have blood going through your lungs, and sometimes this blood pressure is elevated, and then you get a disease called PH. And this can be caused by many different things. And in my case, they don't know why I have this, so they call it idiopathic. It is really difficult to detect. It does require an invasive procedure. You have to put instruments inside your heart and lungs in order to get a 100% sure diagnosis. This is called a right heart catheterization. One of the reasons why it's difficult to detect is that the symptoms can easily be confused with similar symptoms to less serious illnesses. So the symptoms could be one or more of, for instance, shortness of breath, water retention, fatigue, chest pains, dry cough, blue lips, fingers, etc. When a patient goes to a doctor and complains about shortness of breath, the first thing the doctor will think about is that this patient is out of shape. Maybe he has asthma, maybe he has COPD, etc. So that's why it often takes a long time to get this correct diagnosis. And people, unfortunately, their disease gets worse, and at the time they get their final diagnosis, they are often in quite bad shape. I was invited by Actelion, which is one of the pharmaceutical companies, to take part in a meeting. And I was there as a patient, but also as a representative of PHA Norway and PHA Europe. And together with me were other patients. There were representatives from the PH association communities around the world, and also healthcare professionals. So we were invited there to make a patient charter. And this charter is a document that's based on the ERS International Guidelines for Diagnosis and Treatment of Pulmonary Hypertension. It was developed from the output of this meeting. The reason we developed this is that we want to create an easy-to-read overview of what you can expect as a patient when it comes to diagnosis and care of PH. This could also be used by the patient to enable simpler communication with the healthcare professional, so that you together can make decisions and agree on a care plan that is appropriate for you as a patient. I think this patient charter will be important for many reasons. And, today we're moving towards a more patient-centric care. And the patient themselves, they play an increasingly bigger role in the treatment and management of his or her illness. And this charter will empower the patient, since the charter outlines the standard of holistic care that everyone with PAH should receive. So I think this is a first and very good step towards the universal standardized care for people suffering from PAH. I think there are different ways to use this patient charter. One way is, as I mentioned, for the patient to enable him to talk better to the healthcare professionals. But like I see in Europe, there are many countries which struggle a lot when it comes to the treatment of PH. For instance, in some countries, they don't even have access to medication. And I think maybe the patient associations in these countries can use this with the support of PHA Europe to talk to the health authorities and show them what expectations a patient will have to the treatment of his and her disease. In the past, the doctor would give a patient a pill and then that's it. And we also see when it comes to PH that other aspects of treatment is very important for the outcome and also quality of life of the patient. So as this charter outlines, you need a holistic approach when dealing and treating with PH patients. This is something that's described in the document, and we talk about, for instance, rehabilitation. We talk about what kind of food diet people should be on. We talk about psychosocial support, guidance when it comes to traveling, etc., etc. My hope for this patient charter is that it will be to the benefit of the patients and that it will enable them to get even better care that they get today. And my hope is also that in some countries where they don't receive optimal care, that this document can be used to achieve better care for the patients. My name is Skåra, and I'm aware that I'm rare.